Hello, and thank you all for joining us this morning. My name is Kim Bordigaray, and I am the Business Development Director with the Central Valley and Kern County Division of the American Heart Association. The American Heart Association and Community Health Systems have joined forces today to help raise awareness about the correlation between cardiovascular health and maternal health. Unfortunately, cardiovascular disease is the leading cause of maternal death in the US, posing a threat to women's heart health during pregnancy and later in life. Today, we will hear from experts about the latest clinical care, patient tools, and community resources to help support moms in our community. First, I'd like to introduce the panel moderator, Devondrea Sanchez, who is a licensed marriage and family therapist and owner of FIT Therapy. Joining Dee on the panel are Megan Black, who is the interim Black Infant Health Coordinator with the Fresno County Department of Health, Dr. Teresa Danielli, who currently serves as the Chief Cardiologist for UCSF Fresno, Alicia Rodriguez, registered dietitian with Community Health System, and Dr. Raquel Yankee, family medical practitioner with St. Agnes Medical Foundation. After our panel discussion today, we will have a question and answer session that we'll share, and we will also share some community resources on maternal health. So with that, I will turn it over to Dee to begin the conversation.
Thank you, Kim, and good morning. Before we get started, I just have one housekeeping item. If you have any questions for any of the speakers as we go through this program, please type them in the chat box and we will hold questions to the end of the discussion, hoping to get to all the questions if time permits. With that being said, let's get started with Megan and Dr. Yankee. First and foremost, I would like to just have you describe what is maternal health.
Yes, hello everyone, welcome. So, according to the California Department of Public Health, maternal health focuses on the reproductive health of childbearing age women. And so we know that age of childbearing can be a range. And so I would say generally it's from the ages of 15 to 44, but initially it's wherever the start of menses is. And so naturally, when we hear the word maternal, we think motherhood. And I know for myself, when I hear motherhood, I'm thinking of support, I'm thinking of friends, I'm thinking family, community, being prepared, financially, emotionally, mentally, spiritually, all of that will take me on that journey to bringing in life into the world and creating more for myself and for the community and the world at large. And so I would say maternal health includes access to unbiased health and sex education, contraception, routine exams and doctor visits, access to skilled birth attendants, not just our doctors, but those that we have in support of us and mental health support. Maternal health needs wraparound services, and that's what all of those will include.
Yes, and I agree with Alicia in terms of maternal health definition-wise. I think that some of us think of it just when we're pregnant, but it is definitely pre-pregnancy, during pregnancy, childbirth, and another very important period in maternal health is also the postpartum period too, and again, including all dimensions of health, the family planning, conception, prenatal, postnatal care. And I think one of the other things that I've heard that I really liked is maternal health and quality maternal health is not just about the mom, which what we think about, but it's also about our entire communities because the health of that child and the health of the mother impact the entire community that they are a part of.
Thank you, ladies, for sharing that. That was awesome because I think oftentimes we forget it's all encompassing. So thank you for sharing those insights. So how is maternal health measured? And we're going to give that question over to Alicia and Megan. How do we measure maternal health?
Well, one of the ways that we can think about measuring maternal health on an individual level is going to be looking at the BMI and healthy weight gain during pregnancy. And so one of the ways we can do that is find mom's BMI prior to conception and see just about how many pounds she should be gaining. We know that if you're underweight, you should be gaining a little bit more, but if your BMI is between about 25 to 29, you really only need to be gaining about 15 to 25 pounds. And if your BMI is 30 or above, then it becomes about 11 to 20. So just kind of being health conscious about how many pounds you're gaining during pregnancy. Another individual level we'll be looking at is the lipid panel. Cholesterol, we do want to see coming in under 200, triglycerides under 150. We can also take a look at the HDL and the LDL and maybe make some suggestions in regards to diet and kind of thinking about how we can guide mom in terms of what she's eating. Another thing we'll look at too is blood sugar. We know that if you have diabetes prior to pregnancy, we'd really like to see that A1C at 6.5 and then remaining at 6% during the pregnancy. And if you don't have diabetes, then you do have to do that glucose tolerance test at around 24 to 28 weeks. And we do want to see that value coming in low. And if it's elevated, then we know that we need to maybe get you on a meal plan and start guiding you to help manage those blood sugars during pregnancy. And one final thing too, in regards to measuring maternal health, is thinking about, can we get that individual back to their postpartum appointment? Can we get them back in to do a checkup in terms of their A1C, in terms of their blood pressure, and their overall health, how they're doing now postpartum?
I also want to add that, you know, we've already talked in the first question. We started on mental health, and I think, or not I think, but currently, you know, data is collected for preterm birth and infant mortality and maternal mortality, breastfeeding, and postpartum depression rates. And so the CDC said or reports that nationally, 1 in 8 women experience postpartum depression. But many states report higher numbers, such as like 1 in 5 women experience postpartum depression. And so I know, naturally for me, when I hear of infant mortality and maternal mortality, I'm sorry, you guys, I think, you know, we should not have babies and moms dying, especially not here in a developed country. But we don't want that to happen anywhere, you know, across the world. And so we do know that we don't live in a perfect world, and there are going to still, some of these rates are going to still exist, but we would love to see them lower to non-existent. And so I think a way that we can address or we can measure maternal health, and that we do in addition to these rates, is by having programs established, programs to support and combat those numbers. And so we do that here in California through the Black Infant Health Program. This is a state program that was created over 30 years ago to address the infant mortality rate in the Black community. A community that has high infant mortality and preterm birth rates, as well as an increase in maternal mortality rates. We've also seen historically lower breastfeeding rates as well in this community, and this program is here to change that through its prenatal groups, its connection to family health advocates, the inclusion of mental health staff and public health nurses, connecting to resources within communities and such, and just being an advocate and opening up a community and network to its participants. And so we can measure maternal health through essentially wraparound services to all moms, regardless of their income, their education, their background, their color, but just having anyone of maternal age have the support of a program such as this. But even those cultures or those cultures who are experiencing higher numbers and changing that.
Thank you, ladies. And as Megan said, it's in California, it is 1 in 5 that perinatal mental health challenges will be for moms and about 1 to 10 for dads. So thank you for sharing that. And thank you, Alicia, for those numbers as it relates to diabetes and some of the BMI numbers. Thank you. So we'll just move on now, and we'll talk a little bit about blood pressure. So this question is for Dr. Daniele and Alicia. How does high blood pressure affect maternal health in pregnancy? And then just to follow up, as you're explaining that, is there a correlation between gestational diabetes and hypertension? So with that first question, how does high blood pressure affect maternal health in pregnancy? And we'll just go ahead and have Dr. Daniele lead us in that. Thank you.
Wonderful. Thank you very much. And thank you for having me be part of this wonderful webinar today with a group of just excellent and qualified professionals to speak about such a very interesting problem that we face nationwide. As Megan started out, Kim started out with an introduction, letting you all know that maternal death is unfortunately very prevalent. It has increased from the early 90s up until we have data from about 2015. It's maternal death due to cardiovascular disease has increased about 10% over several years. And it's a problem that continues to grow, and we need to increase awareness because we need to turn this around one woman at a time. And so what is the correlation of high blood pressure and maternal death? And is there anything that correlates with gestational diabetes? And the answer is yes. Traditional factors that put us at risk for cardiovascular disease, meaning dying from a heart attack or stroke, are things such as having high blood pressure. And when you are pregnant, we have ladies that have high blood pressure before they're pregnant and at a higher risk of having complications. And those are ladies that are monitored very, very closely. But then we also have ladies that during pregnancy and generally around after the 20th week of pregnancy start having symptoms. They could be blurred vision, nausea, headaches, swelling of their hands and feet and face. And they, if any of you ladies have been pregnant, you realize that first thing they do in the obstetrician's office is measure your blood pressure. And the reason we do that is you can develop a disorder called pre-eclampsia. The definition is a blood pressure of 140/90. And to be honest, in a cardiologist world, we're a little more strict. We don't like anything over 140/80. And that is accompanied with what we call end organ damage. In other words, your blood pressure is so high that you're causing damage to the kidneys. And that's seen by proteins being spilled in the urine. And so one of the reasons why you always have a urine test in the obstetrician office is to check for that protein. And if you do get pre-eclampsia, you are at risk of having full-blown eclampsia. And what's the difference? The difference is you get more serious and actually end up having seizures, coma, and a very high risk of death. Just having high blood pressure during pregnancy puts you at about 68% more likely of having cardiovascular events in your lifetime. Preeclampsia will put you at risk of almost 75% of having cardiovascular complications. And gestational diabetes is basically your inability to regulate your sugar during your pregnancy state. And if that happens, that'll put you at almost 70% more likely of having cardiovascular events during your lifetime as well. What are your risk factors for stuff like this? It all comes down to your family history. Obesity is a big issue that we have in our world. I mean, this is talk about the COVID pandemic. We'll talk about the obesity pandemic that's taken on the world. If you look at the World Health Organization charts on obesity, meaning a body mass index, that's an index measuring your height and weight, and it gives you a number. And if you can use a Google calculator and find out easily what your body mass index is, but anything above 28 is overweight, anything over 30 is obese. And you can see that through the years, we have exponentially grown as humans, and I don't mean that in a sarcastic, funny way. I mean that in a very, very serious way. We're evolving into larger beings, and that's putting us at significant risk for cardiovascular mortality during pregnancy and throughout our lifetime. And so we need to raise awareness of what our risk factors are and how to modify them, because I don't want to come out as doom and gloom. The important thing to all of this is 80% of maternal mortality and women dying in general through your lifetime from cardiovascular related events could be 80% of the time could be preventable. And it's all a matter of managing your blood pressure, your cholesterol, your blood sugar, and most importantly, your weight. So I will end there, and I'd be happy to entertain questions in the chat later on.
All right, thank you, Dr. Daniele. Having trouble getting my video on, there we go. So I wanted to speak real quick also about some things we can do to maybe prevent that in pregnancy. We know that gestational diabetes and then hypertension in pregnancy and preeclampsia do have some shared risk factors, definitely being overweight, having an unhealthy diet, and then having a sedentary lifestyle are all going to put us at higher risk of developing that. So what are some things we can do to prevent that in pregnancy? Having an exercise routine. So even just walking 30 minutes, 5 days a week, that's what we recommend. And it doesn't have to be 30 minutes at one time. You can break that up by 10 minutes after each meal even. Making sure that you're drinking enough water. I'm really big into visuals. So this is an 8-ounce cup right here. The recommendations are for about 10 of those 8-ounce cups a day, and that can be individualized for each mom as well. Making sure you're eating enough protein during pregnancy is really important. Kind of a wide range we give is about 75 to 100 grams of protein per day, but that can also be individualized based on mama's preconception weight. Watching sodium is also going to be a really, really good idea during pregnancy. Find a teaspoon in your drawer when you get home, a measuring spoon. So 1 teaspoon has about 2,300 milligrams in it. And we know that that is about our upper limit of sodium recommended daily. And so we want to be watching that during pregnancy, making sure that we're not snacking on a lot of processed foods or a lot of high fat foods, and just paying attention to our overall intake of sodium and fat. And then one other nutrient that we can be monitoring too in pregnancy is going to be caffeine. We want to make sure we're not having too much caffeine during pregnancy. Recommendations are for less than 200 milligrams per day. So those are just kind of some tips I have for maybe helping prevent preeclampsia or hypertension. And then as far as gestational diabetes, I'll really hit on making sure you're getting enough protein in with each meal. We know that really helps regulate blood sugars as well.
Thank you, ladies. That was great information and great tips. Really talking about weight management and stress management is what I heard. And also, obviously, we can take into account our inheritance and genetics and things like that, but there's a lot of prevention, sounds like. Speaking of those elevated risks, Dr. Yankee and Dr. Daniele, I'd like to discuss briefly the here and now. We're in the pandemic, and a lot of questions are surrounding women, moms in more particular, about how does COVID-19 affect pregnancy? And then, is the vaccine safe for expectant mothers and their babies? A very hot topic right now. So I will turn it over to Dr. Yankee first to enlighten us.
So yes, there is a lot of questions and concerns. And just briefly in terms of background with this, part of my role now is I'm the medical director for our physicians group at St. Agnes. And in that role, during the pandemic for the last couple of years, I have also had the pleasure and the pain of being at the forefront of kind of helping us learn how to respond to this, which is something that is totally unprecedented in my medical life, which hasn't been forever, but well over a decade and a half of practice. And I'm also a mom. And so COVID-19 and pregnancy is initially when this came out, we were unclear. But now the data and the evidence is very clear of the impacts and the increased risk that COVID-19 can have not only on the mom, but also on the baby too. So there's definitely a lot of evidence that show for women who are pregnant and develop COVID-19, and they are more susceptible to COVID-19, have increased rates of hospitalization, just basic hospitalization. On top of that, increased rates of stays in the intensive care unit. So meaning more intensive care because of the stresses that pregnancy already puts on our bodies, and increased rates of intubation, which is needing the breathing tube in order to stay alive. So those data points are solid. It's not a wonder if, it's not a maybe, it might, it is a definite known thing too. And it's unfortunate because there is a lot of anxiety and fear, and self included, about COVID, and then about the second part of the question, which was the vaccine too. So initially we didn't know. I also had the pleasure and pain of being a part of the first vaccinations, administering those vaccinations to colleagues initially and healthcare individuals, and had pregnant doctors and pregnant nurses calling and asking, should I not? And at that time we didn't know. And so at that time, it wasn't contraindicated, but it was have a discussion with your doctor. But now 2 years later, in a year, vaccines have been out for over a year now. We know that the vaccines are in fact safe. It is unfortunate, however, that we also know only 31% of pregnant moms are becoming vaccinated, which is actually lower than our national average. And that is scary. That's something that we want to educate to, but I certainly understand why, because there's fears about will the vaccine for pregnant women, will it hurt the baby? So scientifically, it will not, because the way the vaccine works is it's administered in the arm. The active ingredient is in our bodies for only 2 or 3 days. And then what's left is the ability for our body to fight the virus. So the machinery, the mechanism of action of the vaccine makes it unlikely for it to affect the babies negatively, because it cannot cross the placenta. And so that's another really important thing. The vaccine itself never, even though a pregnant mom may be vaccinated, the vaccine doesn't get into the baby system. But the benefit that does cross over is the protective antibodies. So although, a mom gets vaccinated, the baby only gets the antibodies that the mom produces to help the baby have a higher chance of survival and avoiding that when they're born. That one of the other studies that they've looked at is just the miscarriage rate. So that was a big myth going around, is if I get the vaccine, I'm more likely to have a miscarriage. And that now has certainly been debunked as well, with that data that shows, I think the national average for miscarriage, I looked it up, I had it somewhere, was 11 to 16%. And those miscarriage for those who've been vaccinated is about 13%, which is smack dab in the middle of that national average, which would show that there's no increased risk of miscarriage from that. But what we do know is that there's an increased risk of preterm birth, and there's an increased risk of stillborn birth, unfortunately, for mothers and for babies who have COVID-19 during pregnancy.
Yes, thank you. And I will add on to that. I can't stress the importance of getting vaccinated during pregnancy. I mean, yes, I understand the initial, response. Anytime you're pregnant, you're worried about everything. And I've been there. I have 3 children of my own, and of course you're worried. But now we have good studies and we have longer term data to support that the vaccine is absolutely safe. What have I seen in clinical practice? I mean, we bear the brunt of seeing the bad outcomes. And unfortunately, it is absolutely heartbreaking to have seen the significant numbers of pregnant ladies on a ventilator in the last 2 years, and just suffering unnecessarily. We've had cases where pregnant mothers we were trying to save the mother and the baby unfortunately passes. I mean, these are obviously the grave cases, but what has been shown is that there is definitely an increased risk of severe outcomes with COVID during pregnancy. So pregnancy puts you at risk of being sicker, and as Dr. Yankee was saying, a higher risk of needing the ventilator or the breathing tube. Stillborns, preterm labor is also more common, delivering prior to 37 weeks pregnant. And disproportionately, the African-American women and women that develop diabetes are at significantly more risk of having a more serious course of COVID than their non-African-American counterparts or non-diabetic women. So it is a serious issue. And I believe the other part of the question was, is this recommended for pregnant ladies? Yes, it is recommended. It is supported by the Obstetric Society, the American Heart Association, and all the major, all the data is pointing to safety of this vaccine during pregnancy, and the recommendation is to get vaccinated prior or during pregnancy.
And one of the things I might add, if there are women who are pregnant, pre-pregnant, and considering it too, is just have the discussion with your doctor. I think that is important. I think it's important to, if you have anxiety or concerns, that you bring those up and address them too, and not feel like you're being forced to do it, but talk to people who want to listen about it too. And one of the other things that weren't asked, but it has, it also for nursing moms, it's also important in that state too. And it has not been shown to date to have any effects in terms of that as well.
Thank you, ladies. That was so informative. And I think it is also important to hear doctors who have empathy especially with pregnant moms in light of the pandemic and things that are going on, and hearing you to discuss the anxiety, the disproportionate numbers of health risk and information. It is really important that they can come to their doctor individually and have that empathy, but also accurate information just in light of everything that's going on. So thank you, ladies. The next question is for Alicia and Dr. Yankee. Can you please just let us know what type of foods are recommended for healthy pregnancy?
All right. Wow, my favorite topic. So when we are thinking about healthy eating for pregnancy, it's actually not too different than how we want to be eating in general to support a healthy lifestyle. We want to be getting in lots of vegetables, lots of non-starchy vegetables, choosing fruit 1 to 2 times a day, making sure we're getting our carbs from complex sources. So this is going to be whole grains, choosing multi-grain bread, brown rice, whole wheat pasta, maybe some starchy vegetables as your source of carbs, so beans, peas, lentils, some potatoes. We want to make sure we're choosing lots of lean protein. So that's going to look like chicken, we're removing the skin from. We're choosing fish 2 to 3 times a week as we're allowed to include it in our diet. Red meat maybe 1 to 2 times per week. We're looking at some plant-based protein sources as well. So tofu, nuts, seeds, peanut butter, or cheese and eggs. Thinking about fat, we want to be eating heart-healthy fat. So we know that some fat can be dangerous for our heart. That's called saturated fat. And then some fat can be protective for our heart. Those are our mono and our polyunsaturated fats. So in that regards, we want to be choosing avocado, nuts, seeds, cooking with olive oil and vegetable oil. Making sure that we are getting at least 2 servings of fatty fish per week. So this is going to be like including salmon in our diet. A few key nutrients I want to talk about is folic acid. We want to make sure we're having enough folic acid during the preconception stage. So this is going to be about 400 micrograms daily. Most prenatals are going to include that or even more. You do need 600 micrograms per day during pregnancy. Some great food sources of folic acid are going to be your lentils, your beans, your peas, your leafy greens. We want to make sure we're getting in enough vitamin D and calcium. We know that those are both really important for bone health and baby's overall development. Some great sources are going to be, of course, our dairy products. So trying to eat dairy 3 times a day is going to be helpful. For vitamin D, that can be a little bit more tricky. You might need to supplement. Some good sources though, fortified foods, some fortified orange juices or milks. Again, with the fish, about 2 to 3 servings of fatty fish is considered safe in pregnancy. So going back to that salmon, that would be helpful as well. And then the last nutrient I want to talk about real quick is iron. We need almost double our iron needs during pregnancy. So again, you might need to supplement with iron, but choosing beans, peas, lentils, squeezing a little bit of lemon juice over that before you eat it, that's going to help with the absorption of iron as well. And there are some safety considerations too when we're thinking about eating during pregnancy, what foods we should be choosing. I know I did mention fish, and so some of you may be thinking, well, is fish actually allowed? You are allowed 8 to 12 ounces of seafood, avoiding certain kinds though. So for anyone that really enjoys eating shark, I gotta tell you, shark is off the menu during pregnancy. So that's gonna include swordfish and tuna as well. We know that those bigger fish are gonna have higher concentrations of mercury in them, but I gotta say salmon is okay. So keep eating that salmon, about 2 or 3 servings a week.
And I agree with Miss Alicia. I think I'm hungry because it's lunchtime and you're talking about all those healthy things and things I love to eat. I just want to remind people too that we have this adage about eating for 2 during pregnancy, but really for the first trimester, that doesn't require a lot of extra calories for your body. And during the second trimester, the caloric intake increases about 340 or so, and maybe 500 for the last trimester. So 340 is like a Snickers and something else. It's not a lot. So I think the misnomer of eating for 2, but having been pregnant now 3 times, and I have 3 lovely children, or 2 teenagers, one will be 14 tomorrow, and one 10-year-old, I understand the cravings that I had, and I know some of the runs that I made to Taco Bell did not fit in alignment with what Alicia said, and I had to kind of hide the wrappers in the garbage can because my husband was in a whole big tizzy. So I think that just that balance, because I think everything in moderation, but also on a more serious note, when we talk about what we should avoid, we're talking about cardiovascular illness and disease, and salt definitely is something that you want to moderate, is particularly tying back into what Teresa was talking about earlier with pre-eclampsia, those who have a history of diabetes and high blood pressure, and in minorities, particularly African American, the risk of hypertension is much higher, as are the pregnancy-related complications of potentially heart disease, preeclampsia, stroke as well. So I think the things that we can eat, we know, and also learning what things to moderate. I think Alicia also mentioned earlier a little bit about caffeine. We hear stuff about coffee like every day. It's good, it's bad, you should, you shouldn't. I think she did discuss the 200 or so milligram a day limit, which is about 2 8-ounce cups of coffee, or a few cups of tea. Some people like tea. So I think that has definitely been shown to be acceptable for women, but not overdoing it, because there's also caffeine if you're doing a lot of sodas and things like that. So taking all those things into moderation. And I think that's the key, is just moderation too. So you got to enjoy, you might splurge here and there, but overall making sure you're getting the nutrients that you need, that she discussed in detail, and trying to limit some of the things that you don't need. And for certain people, you can use the thing, I'm eating for 2, but just in your own head and heart and body, know that you're still eating for 1, and you have to live with that 1 for the rest of your life.
That's so awesome. Thank you, ladies, for just reviewing those healthy food options. A couple of things that they hit on as an integrative nutrition mental health professional myself. Food and mood. There's a lot of science behind inflammation with the foods we should stay away from. So moderation is exactly right, Dr. Yankee. And being that African-American females rank #1 in the obesity population, we need to take a little bit extra care about those foods that we consume. So thank you both for just reviewing some of those food options. The next question that I'm going to bring is for Dr. Daniele and Alicia. So the question is, if someone is considering becoming pregnant, is there anything they can do to reduce the risk of developing pregnancy complications and cardiovascular disease?
Sure, thank you, Dee. I'll start with that. So ladies, I want you to look at this as global risk, right? Not just pregnancy. And we'll talk about pregnancy in particular, but remember, 1 in 3 of us, whether we're pregnant or not, 1 in 3 ladies will die of a cardiovascular event, lifetime. Those are staggering numbers. So if you're in a room with people, look to your right, look to your left, pretend it's the imaginary person because you don't want it to be you, but 1 out of 3 of us will die from a cardiovascular related event. And so this is a marathon. We should not just prepare when we are pregnant. We should look at this as global risk, as lifetime risk. Fortunate for us, the risks that increase our the risk factors that'll increase our maternal risk, meaning pregnancy risk, are also the ones that increase our risk lifelong. So we can learn habits, good habits, and keep them for your whole life, because this really is a marathon. Having said that, what can we do? Alicia did a great job talking about some of the vitamins, the folic acid, the iron, the calcium supplementation. So I'll leave that up to her. But things that you can do is, number 1, have a normal body weight. I cannot stress the importance of a normal body weight. It is also the hardest thing to achieve. I cannot give you a pill, a magic pill, to say, here you are, lose 20 pounds, or else I would use it myself, clearly. It's an easy fix, right? But there is no easy fix. We know that the more we weigh, the heavier we weigh, the higher the chance of mortality, not only for cardiovascular lifelong, but complications during pregnancy. Being higher weight is also associated with higher blood pressure, higher cholesterol, diabetes risk, stroke risk, sedentary lifestyle. So what can you do? And if you're pregnant now, you're thinking, oh my goodness, what can I do? It's all doom and gloom. That's not the case, right? You can always make a difference starting today. Eat. You go to the grocery store. I always tell my ladies, go to the periphery of the grocery store, right? The periphery, all the colorful stuff. The inside is all fluff, unless you're stopping for, cleansers and toilet paper. You should stick to the periphery. Stay with unprocessed natural foods. Start being physical. Walk. Just move. It is a privilege to walk. Think about all these poor people in wheelchairs, and goodness, they've had strokes. It is a privilege. They would do anything to have your 2 legs and get out there and move. So don't take it for granted. Get out there and enjoy life. It's good for mental health as well, right? Because we know that people in general who have heart disease that end up having depression and anxiety do worse. We know that. And mental health is just as important as your medical, clinical health, and those come hand in hand. And for years, since the history and the beginning of time, I can venture out and say that, we put ourselves on the back burner. We're busy, right? We're busy. Everyone's busy. We're busy being a mom. We're busy being a caretaker. We're busy being a friend. We're busy listening to everybody's issues, and we get in control and tell them how they should make their lives better. But who's taking care of you, right? We are role models, and we need to take charge of our mental and medical health, because if we don't, we will not be around for other people, and we cannot do what we do best, and that's help the world, right? And so what can you do? Start eating well, taking a mental break, walking, getting some physical activity in, and absolutely speaking to your doctor about what your risk factors are and how you can modify those risk factors lifelong and during pregnancy. So I will end there.
Wow. Thank you, Dr. Daniele. That was very sobering, thinking about the 1 in 3. I'm alone in my office, but I was definitely looking around and thinking if there were 2 other people here, that's not good odds. But what can be done if someone's thinking about considering becoming pregnant to help reduce the risk of complications? I definitely agree with being at a healthy weight. That is number 1. You can find out what your suggested BMI is and work towards that number, even if you can't get that exact number, because we know the BMI chart can be a little unfair sometimes. Thinking about even just losing 10% of your total body weight, we know that we can see improvement in blood pressure and blood sugars if we can lose about 10% of our total body weight. So that could look like starting an exercise routine, and it doesn't have to be the gym. It could just be walking around the neighborhood. It could be putting on YouTube videos at home and just dancing. It could be walking your dog. Just making exercise a part of your daily life. I would also suggest knowing your numbers. If you have diabetes or if you have high cholesterol or high blood pressure, know what your normal numbers are. Meet with your doctor, maybe ask for a referral to a registered dietitian, and think about how you can improve those numbers prior to pregnancy. Thinking about making diet changes prior to pregnancy, starting to lay the foundation for good nutrition prior to fetal development. So that could look like starting a prenatal prior to pregnancy. And then overall thinking about what some of your habits are that we maybe don't want to continue into pregnancy. I'd say number 1, we don't want to be drinking alcohol, we don't want to be smoking, and we don't want to be exposing ourselves to some of those environmental factors as well. So ways that we can eliminate that. And then also thinking about reducing stress prior to pregnancy too. We know that chronic stress can be very inflammatory towards our body. So that kind of goes hand in hand with mental health too, thinking about how we can ask for help in our life, how we can relax and maybe not be in charge of helping everyone, and taking some time to really do some deep breaths, do some meditation, and calm down. That goes hand in hand with thinking about how we can be healthy prior to pregnancy.
Thank you, ladies. That was great information, not only to discuss that, but also acknowledge how difficult some of those changes can be, even starting to as simple as asking for help in mental health. So thank you for acknowledging that and for the information. Our next question is going to be for Danielle Lee and Megan. So what can be done to modernize maternal health care delivery?
Okay, I'm hoping that you guys can hear me. I'm seeing I'm having a little connection issues on my end. But I think a simple way that we can modernize healthcare delivery is to ensure that every woman has access to an OB and OBGYN that they are comfortable and confident in, as well as a doula. Last year, we saw the passing of the Omnibus Act, which addresses the maternal health disparities in the Black and other minority communities. And with that program, with that act, we should see increase in financial backing for doulas, the implementation of actual training for doulas, but also the hospital settings need to be welcoming to the addition of these skilled birth attendants when moms enter in for delivery. Being in the Black Infant Health Program, I have a wide range of access to Black women hearing their birth stories and the hardships that they experience and the joys that they go through that come about from it. And yet, while doulas have been around for many of decades, many of times, and even with the implementation of the passing of this new act, I still have women sharing the difficulties that they have when they go in to deliver, and how their doula or their family members or their friends or their loved ones to support them during this time have been turned away or turned down. And we know, yes, during COVID, the world definitely looks a little bit different. Even going into doctors, the hospitals looks a little different. But as we talked about earlier with maternal health, it's not just that woman, it's a community, it's the family. And so we need to ensure that those that they have, that the women, whoever they have going with them to support them in this new journey is supported as well and welcome.
No, and I agree. And I would stress the importance of a team-based approach. And it's something that I think we do to some degree, including the doula and education and about the delivery process. But I think we can do a lot better in identifying a higher risk individual who's coming into the OBGYN's office, someone whose body mass index is already higher, someone who's already coming in with hypertension, someone who becomes gestational diabetic, and refer these to, either a cardiologist or back to their primary care physician to say, hey, you are at risk, significant risk, and we need to manage this during pregnancy and after pregnancy, because pre-eclampsia, you can have high blood pressure and pre-eclampsia develop even 6 weeks after postpartum. So your maternal risk does not end just with pregnancy. And actually 30% of women that pass away from maternal complications during pregnancy happen during pregnancy themselves. Another third post with delivery. And the other third is 1 week to almost a year after delivery. So complications are not just during the immediate event, but they do linger. And I think a better way of approaching this is really educating our moms to say, look, you are at risk, and this puts you at risk, and you need to follow up with this and make sure that you have those open communication with that patient, because we've all been there. We're young, we're healthy, nothing's going to happen to us. And one of the hardest things for my women patients, and for some reason it's always women, they have a hard time accepting that their blood pressure is high. They'll come in and say, I'm nervous today, I was running, I was rushing, I have white coat syndrome, every excuse in the book, or I feel fine. But the reality is, it is the biggest silent killer, because you don't often feel bad unless it gets really, really high, and it's causing harm the whole time. So I think, a great way would be really to have this high risk team that includes a cardiovascular risk assessment that follows beyond just pregnancy and delivery. And that would be, my sense of how we can modernize maternal health, and really education. And webinars such as this today go a long way. I mean, this is just the first step of arming our women with knowledge. And I always say knowledge is power, and it really is, because you need to know the risks that are the factors that are putting you at risk, and arm you with information to overcome this, so you will no longer be a statistic.
Wow, thank you, ladies. You both I love the directness. I love the, the heightened attention that we should be taking with our moms during pregnancy as it relates to taking care of ourselves. And thank you for addressing that, Dr. Daniele and Megan. You guys gave great information. So lastly, I want to ask Dr. Yankee and Megan, what can we do to address the gaps in equity in regards to maternal health?
This is a tough one because there's so much with this one. I think the first thing I would say echoes on what was just said, and a different quote, though. This one is from John 8:32 in the Bible, and it says, "Then you will know the truth, and the truth will set you free." And so I think the first thing that we have to do is engaging in conversations and understanding what the truth is, the reality of the discrepancies in our healthcare system. Again, not just for maternal health, but for all health. I think, in May of 2020, with the unfortunate murder of George Floyd, that started kind of this renewed conversation and a reckoning. And then also, with the data that's come out with COVID-19 and the disparities in our populations and in our health systems. So I think that was one of the pluses. One of the other pluses, both from the death and then what's coming from COVID, that I've seen as a physician, is I've seen organizations start to take a little bit of responsibility, but at least they're acknowledging that implicit bias, individual and systemic racism that exists in the healthcare system and other social institutions are some of the areas that we as physicians and nurse practitioners and affiliated organizations, we have a separate responsibility to help impact those systems that we work in. And I think some of the things that were alluded to, such as standardization of patient care, so that you come in with high blood pressure, don't get treated any different than somebody else coming in with high blood pressure as it relates to particularly maternal health. Same thing, standardization around pregnant women and hypertension, around hemorrhage, around blood clots, things that are the cardiovascular illnesses that do lead to that disproportionate death rate and morbidity with women. I think those are things that as a system we can start to do. I think individual, it comes down to that awareness, as well as taking ownership of yourself, your body, your life, and being engaged. Sometimes women or people in general think that that's something that happens to somebody else and they just kind of go with the flow. But I think learning how to be an advocate for yourself and for your family members is also another important step in terms of adjusting some of these equity gaps, because I can look at different patients that I've treated, different races, socioeconomic, and some are more likely to step up and ask questions, and some are more likely to sit back and kind of shy away. And I think it's important to empower with, again, things like this, empowering women with the information and the truth, so that they can ask very, valid questions and questioning your healthcare doc. If you don't agree with something, you have the right, and your unborn child has the right to ask those questions and to get an answer that you're comfortable with. And if you're uneasy still in your spirit with it, you have the right to get another opinion. You have the right to reach out to other folks and to shared experience. I think that's the plus and the minus with the internet. There's a lot out there, but some of it is very valid. I think one of the final things I think that I would say in terms of what other things can you do outside of yourself and what the responsibility is of the medical community, is also being involved with organizations such as this, the American Heart Association, and other organizations that push for governmental and policy change. One of the things that I wasn't aware of until helping prepare for this was the Advocating for American Rescue Plan Act, which was a provision that extended Medicaid and child care health postpartum. I think it was a minimum of 60 days. And through that act, of which the American Heart Association was a strong proponent, they extended that postpartum care for up to a year. And that starts, I think, in April of this year. So if you don't know where to start, or it seems like too much, how can I advocate? It's just local community things, bit by bit by bit, talking to your doctors, getting on the internet and seeing what's going on, talking to other folks who might know, because there's tons of ways you can advocate on that level too, which is getting involved, just engaging and getting involved. I think that is an individual thing you can do. And again, advocating for yourself if there's questions that you have, and encouraging and supporting organizations that do some of that work on your behalf.
That was awesome. Thank you. Thank you. In light of time, we are just going to go ahead and close for now. Thank you, Dr. Yankee. I think you spoke to a broad and a very specific, which is, I think you started off saying this was a big question to tackle, and I think it definitely uses for more conversation. So thank you, panelists. Now, if there are any questions that were in the chat that were unanswered, as they are, we will do our best to answer all of those questions once we close for today. I want to thank all of our panelists for being here. Thank everyone for this great dialogue. that we've had. There are some resources that are highlighted here, as you can see. And American Heart Association, Community Health. There is the DAD Project out of Madera County for those who are looking for information about paternal perimental health and concerns as that applies, and depression, anxiety as they go through the journey and the course with the mom during the pregnancy and after. Definitely feel free to reach out. We'll put information in the chat. We thank you all for just being here, and if there are anything that is not said, such as the Fresno County Department of Public Health and Black Infant Healthcare Program with Megan Black, please feel free to reach out. And Kings County Maternal Wellness Coalition, that I have the opportunity of sitting on that committee, and we're doing a lot of things as it relates to up the Central Valley Coast. So thank you all for joining us. Again, we will put any information in the chat. And Kim?
Yeah, thank you, Dee. Also just want to thank the panelists, yourself, Dee, Dr. Daniele, Dr. Yankee, Megan, and Alicia for all the wonderful information you guys have shared with us today. After this webinar, you should all receive an email with the recording of the program today, along with the resources that Dee and everyone on the panel has mentioned, as well as resources from the American Heart Association and Community Health Systems. So thank you guys for attending, and please stay well.